My name is Paul Offit. I'm talking to you today from the Vaccine Education Center at the Children's Hospital of Philadelphia. It's Monday, March 23rd, 2026. What I want to talk about is an interesting court case that was decided a week ago on March 16th, 2026, because it's relevant to children. So let me tell you how this court case came into being. On February 23rd, 2025, Robert F. Kennedy Jr. was sworn in as Secretary of Health and Human Services. He has had a history of being anti-vaccine and being a science denialist, so people were understandably worried. On May 27th, 2025, RFK Jr. stood up in front of the American public on a 1-minute post on X and said that he, the Department of Health and Human Services, was no longer going to be recommending the COVID vaccine for healthy children, nor was he going to be recommending it for pregnant women. Even though it's clear that over the previous year, about 2,000 children were admitted to the hospital with COVID, virtually all were unvaccinated. About 1 out of 5 of those who were admitted to the hospital were sent to the intensive care unit, and 152 children died. So of course that vaccine was still of value. Similarly, pregnant women have about a 1.5 to 2 times greater risk when they have COVID of being hospitalized and then sent to the intensive care unit and ventilated. So those two recommendations were contrary to the science. On June 9th, 2025, Robert F. Kennedy Jr. fired all 17 members of the Advisory Committee for Immunization Practices who had an expertise in vaccines and replaced them with people who didn't, who, like him, were science denialists and largely anti-vaccine. On September 18th, 2025, this new ACIP, this newly constructed ACIP, basically revised birth dose for hepatitis B vaccine, thus putting children at unnecessary risk and at risk of later in life developing cirrhosis, which is chronic liver disease, or liver cancer. On January 5th, 2026, the Department of Health and Human Services put out their own vaccine schedule that was contrary to the American Academy of Pediatrics schedule, in that it made 3 vaccines that had been routinely recommended optional. It made 5 vaccines that had been routinely recommended only now for high-risk groups, even though all groups were at risk. So that too put children in harm's way. Now, in the midst of all this, the American Academy of Pediatrics, along with 5 other scientific or medical groups, sued the Department of Health and Human Services, claiming, quote, that decisions limiting access to vaccines were unscientific and harmful to the public. So on March 16th, at a federal court in Boston, Judge Brian Murphy ruled on that lawsuit. Was the AAP right? The American Academy of Pediatrics, were they right? Were these other scientific and medical societies right? Was Robert F. Kennedy Jr. and his Department of Health and Human Services putting children and others in harm's way? So there were 3 basic rulings that came out of that, and I'll read them. Quote, for now, the revised childhood vaccine schedule issued in January 2026, the one that made several vaccines optional, by the US CDC, which reduced the number of routine childhood immunizations without evidence, may not be implemented. 2, Secretary Kennedy's handpick appointments to the CDC's ACIP were likely improper. Therefore, the committee may not meet or take new votes on vaccine policy changes. And then lastly, quote, all votes taken by this reconstituted ACIP are invalidated, which includes votes from last year that altered recommendations for COVID-19, flu, MMRV, and the hepatitis B vaccines. So as it stands right now, there is no advisory committee for immunization practices, and everything that they've done since Robert F. Kennedy Jr. became Secretary of Health and Human Services is invalidated. Now, the good news is other groups have stood up. Groups like the American Academy of Pediatrics have a routine childhood vaccine recommendation that's given by an expert advisory group called the Committee of Infectious Diseases, or Red Book Committee, and that is a source of excellent information. And there are other excellent sources. So this was a seminal moment, I think, for Robert F. Kennedy Jr. when he has now come to face a lot of the bad decisions that he's made and a lot of the bad information that he's put out to the American public.